I really think one of the ways that technology can help bridge this gap is really what it does to clinician efficiency and what that does for access. So, in what ways can technology help bridge gaps in access to medical services? I don't want to talk about the one that's beaten to death, which is the whole geographic location, right? Like everybody understands that. If you live far away or maybe in a rural setting and your nearest hospital is 3 hours away, virtual, telemedicine can help a lot, right? You now can do it without having to drive 3 hours. That's wonderful. That's kind of low hanging fruit. I really think one of the ways that technology can help bridge this gap is really what it does to clinician efficiency and what that does for access. So, for example, in the standard and traditional fee for service model where clinicians are billed on or billing on time and they're paid for the amount of time and the number of time units that they bill in a given day, what technology allows us to do is move more towards value-based reimbursement systems and schemes. Maybe it's global fees for service or lump sum payments or something like that, that opens the door to clinicians being able to do what is most efficient to get the best outcome without having to spend, we're not going to say unnecessary, but extraneous time in order to hit certain billing thresholds, right? Like if a patient comes in or is referred to a clinic and that clinic knows that they need to see the patient for at least 45 minutes to an hour in order to bill, 3 or 4 timed units in order to get reimbursement and make it financially worth it for them, the incentives then become for the clinician, how can I bill the highest amount for the least amount of time, right? If you're in a position now where you've moved into value-based reimbursement and you're getting a lump sum of payment, then it really doesn't matter whether you see the patient for 10 minutes or 10 hours. You're going to get paid the same amount, for example. Maybe you're getting paid on outcomes. Maybe there's some kind of shared reimbursement or something, shared savings or something. What technology then allows you to do is be more efficient with your time, because then maybe instead of having this patient come in and spend an hour in the clinic, it can be handled via a 5 or an 8 minute telemedicine visit or something like that, or even asynchronously, right? Asynchronous secure messaging between the clinician and the patient, and all of that stuff improves the efficiency of the clinic, which increases its capacity. So now it can actually see many more patients, deliver the same level of outcomes, all and arguably with less cost to each individual patient, each individual payer. So that's one of the big ways that I see technology helping bridge this access gap. It's not going to be enabling clinicians to double down on archaic billing or revenue models. It's going to be opening the door for new and innovative ways for both paying for healthcare services, but then delivering those healthcare services.